Education and Sports Medicine, more letters after more training and tests. I've even added this one on occasion, OCRLMPPMD. That one stands for Obsessive Compulsive Repetitive Last Minute PowerPoint Manipulation Disorder. And it's true, I'm always fidgeting with the slides until the very end. And being in Washington, I actually contracted this disease from Wei Yin, who is out in Bellingham. But I've never added this one before. Symptoms since May 2011. Diagnosed July 2011. When Jennifer Hansen asked me to speak to you today, part of my email response to her was, I've given countless of medical talks which are easy for me to give when I know more than anybody else in the room about what I'm talking about. This is a little tougher on me because I'm only an expert in my own experience with ALS. So I need to add a few more letters, and all these pictures have been taken since last July. BDE, best dad ever. CMBPP, that stands for Cool Mountain Bike Picture Poser. HOWSC, hangs out with shady characters. UCSRP, that one is Undercover Semi-Retired Physician. Those are last Halloween. It's always fun to put hair on the bald guy. There's probably a bunch of you actually who can put this behind your names. This talk really isn't about me. There are many great stories of people living life courageously with ALS. Some are pictured here and some are in the middle of your tables. You as my audience for the next 20 minutes are here for different reasons. Some because your lives have been touched with ALS. Some because you want to learn more about ALS and what you can do to support. And maybe some of you are here because you thought this was a Rotary Club meeting. If so, it's okay to leave. But before you go, this lunch is about giving. But I want to give you something back in return. I want to teach you about life lessons that I've learned in the last 10 months. I'm going to give you a better understanding of what the Evergreen Chapter of ALS Association has been to me. I'm going to try to convince you that vulnerability is not a bad thing. And I'm going to talk about really living in today. I have pretty vivid recollections of medical school having a patient with ALS come to speak to us. I remember thinking, this guy's got a pretty bad disease and he's here spending his time to teach us about the disease. I also read Tuesdays with Morrie. Until the Missoula Walk last fall, that was about the only personal contact I had with ALS. This is by far my favorite t-shirt there. Shortly after my diagnosis, a friend and nurse at our surgery center, Leslie, asked me if I would join Team Schroeder for the walk. And since the team bore my name, I figured I better be there. And I'm really glad I did. I was able to make personal connections with many people, and I still frequently think of them today. I realized that I was not alone. Shortly after my diagnosis, I traveled to Seattle for diagnostic confirmation and to establish multidisciplinary care at the Virginia Mason Certified ALS Center. My visit included time with a physical therapist, an occupational therapist, a speech therapist, a dietitian, a social worker, a representative from the ALS Association, and of course Dr. Mike Elliott. Where my local neurologist knows of 3 patients in the region living with ALS. At the ALS Center, I was able to have answers to all my questions from professionals whose schedules are filled 1 day a week with ALS patients. At that visit, I was also given a very important piece of paper, one that contained information and contact for the ongoing trials in the Pacific Northwest. I enrolled in it and still participating in the MP001 clinical trial. After an initial screening visit, I traveled to Olympia, Washington for 6 monthly infusions of clear IV bags filled with either drug or placebo. I'll find out what I've been getting this fall. I'm currently in the 6-month follow-up portion of the study, and it's a little anxious to know that for the next 6 months I may not be receiving and have absolutely no way of receiving something that was potentially really helpful at slowing my progression. I tell people the best case scenario is that the drug is really effective and that I've been getting placebo. In 2011, the Evergreen chapter of the ALS Association provided more than $60,000 in advocacy and research. And the entire ALS Association raised $2.7 million in research funding. There have been some really big research findings in the last year that lead us closer to understanding the cause of ALS, and more importantly, point us towards targets for potential intervention. This brings me hope. The final update to my 2011 Walk personal page contained this picture and the following text. I wore my 2011 ALS Walk t-shirt the day I received the last infusion in my first cycle of the MP001 study. That morning I looked at myself in the mirror and I had to update the picture for you to see what I saw. Hope. We do not know what lies ahead, but go forward with trust in God's plan for our lives. Courage from the support of our family and friends, and indeed hope for our future. The progression of ALS symptoms is typically pretty linear, and I feel fortunate that over the last year, the slope of my curve has been pretty slow. I continue to work part-time and live independently, but it's comforting to know that the Evergreen chapter has got my back. I have no idea what I'll need in the future, but I'm comforted to know that the resources of the Evergreen chapter will be there for me, whether that's equipment loans from the loan lockers, support groups, camps for kids whose lives have been affected by ALS, or the expertise of knowledgeable people to point me in the right direction when something difficult or unexpected presents itself. I want to switch gears now and talk about vulnerability. I've been keeping a journal of my thoughts and experiences living with ALS, and it's been a helpful outlet for me and point of reflection. It's provided me with a lot of raw material for this talk as well. But I believe this initial entry best describes my motivation to write, my children. Throughout this journey, they will be busy on their own growth. I want them to be able to look back fully grown and have the opportunity through these words to understand their father on many more levels than they will be able to comprehend their first trip on this journey. I also want to share with you one excerpt fairly early on as my mind began to explore and process what ALS has the potential to do to my body. I was learning about speech-generating devices. I find myself worrying most about the bulbar symptoms, those that would take away the normal ways I communicate with people. I believe I could cope without the use of my arms or my legs, but to be unable to smile at people, kiss someone, or even talk would be emotionally devastating. Communication is what connects us to others, and verbal and facial expressions are so important. These speech-generating devices give me hope that even though my body may not work, I can still connect with others and give back by saying thank you, or I'm happy, or I love you. I'm a big fan of TED Talks. I've got the app on my phone. I recently listened to a 2010 TED Talk by Brené Brown titled The Power of Vulnerability. She also has a book called The Gifts of Imperfection, which is on my ever-growing reading list. In her talk, she describes that wholehearted people with a strong sense of loving and belonging, have the following four things in common. They have courage, and this is different than bravery. They live exactly who they are and have the courage to be imperfect. They have compassion. They have compassion to be kind to themselves first, and then to other people. They have connection as a result of authenticity. They are willing to let go of who they think they should be in order to be who they are. And they have vulnerability. They believe that what makes them vulnerable also makes them beautiful. They don't talk about vulnerability as being comfortable nor excruciating, but it is necessary. She says that vulnerability is the birthplace of joy, creativity, belonging, and love. "16 years ago, I had hair, and I was a college football linebacker, and now my kids, they can outrun me, but don't tell them that. ALS is a crash course in vulnerability, and there are two options. You can fight it or embrace it. The end result will be the same, but the choice between fighting and embracing determines how we view the scenery along the way. All of us have deep areas of vulnerability in our lives, and it's easy to fall into the dangerous cycle of trying to hide or ignore our sense of vulnerability. But Brené Brown reminds us that we cannot selectively numb emotions. Numbing vulnerability also makes us numb to joy, gratitude, and happiness, and then we become miserable and go looking for purpose and meaning, and then we feel even more vulnerable. ALS has taught me a new way to see and experience the world, and I hope that after leaving here today, you may take just a little of what I've learned of a new way to live, nicely laid out in Brené's talk. Let yourself be seen, deeply seen, vulnerably seen. To feel that vulnerable means you're alive. Practice gratitude and joy. Tune into even the little miracles of every day. I'm going to come back to that one too. Believe that you are enough, just as you are. And love with your whole heart, even though there's no guarantee. Have the willingness to try something new. To say, I'm sorry I hurt you. To invest in an idea or relationship that may or may not work out. To ask for help. Or say, I love you first. I want to end by not talking about the future. Many speakers will conclude the presentation by projecting or relating what they've just presented into the future. Not me, not anymore. I'm continually telling myself, today is the best day I have today. Another excerpt from my own reflective writing. I realized that I was feeling the least amount of stress in my life that I could remember for a long time. I'd always been making decisions to put myself somewhere 5 years down the road, get into college, get into medical school, get into residency, get into fellowship, find a job, build a practice, get a better job, build a better practice, position myself well in the unknown future in politics of healthcare. I realized that for the first time since childhood, I was making decisions for the short term, and it felt good. One of the greatest things about having kids is learning to see the world through their eyes. They can drive a not-so-patient guy like myself crazy sometimes, often. But for them, there's an exciting newness in what we see as everyday experiences. Thanks to my kids, I've eaten a lot of snow on the side of a ski hill. I've picked up a lot of little pieces of trash that I never would have noticed before. And I've stopped to notice all the little bugs and berries on the underside of leaves along a hiking trail. They're not thinking about college, bills, or what to post on their Facebook page. They're taking in everything the current moment has to offer. In 2005, Steve Jobs, founder of Apple and Pixar Animation Studios, gave a commencement speech at Stanford University. About 1 year before that talk, he was diagnosed with pancreatic cancer, and he believed that he had been cured. He said, "I've had surgery and thankfully I'm fine now." But that experience made everyone listen as he talked about living one day at a time. He recalled a quote that made a lasting impression on him at age 17. "If you live each day as if it were your last, someday you'll most certainly be right." For the 33 years that followed, he reported he would look into the mirror every morning and ask himself, and this is a long quote, "If today was the last day of my life, would I want to do what I'm about to do today? Whenever the answer has been no for too many days in a row, I know I need to change something. Remembering that I'll be dead soon is the most important tool I've encountered to help me make the big choices in life. Because almost everything, all external expectations, all pride, all fear of embarrassment or failure, these things just fall away in the face of death, leaving only what is truly important." And he continued, "Remembering that you are going to die is the best way I know to avoid the trap of thinking you have something to lose. You are already naked. There's no reason not to follow your heart." One of the great inventors of our time said that death is very likely the single best invention of life. In another TED Talk, a woman named Stacy Kramer describes a very special gift that she had received. This gift brought all of her family together, made her feel loved and appreciated like never before, reconnected her with friends and acquaintances she hadn't seen from in years, overwhelmed her with adoration and strength, recalibrated what was most important in her life, redefined her sense of spirituality, and gave her a new understanding of her body. Sounds like a great gift, right? But in the end, she revealed that the gift was a brain tumor. I'm not going to stand up in here and tell you that I'm happy to have ALS. But I can really relate to her closing words. So the next time you're faced with something that's unexpected, unwanted, and uncertain, consider that it just may be a gift. I want to share with you part of what I wrote in our 2011 Christmas card. Except for the disease, everything is better for us. We have learned to live in the present because the future is so unknown for all of us. We have more time to spend together as a family. Loving our kids and providing them with experiences to grow in person and in faith. I knew this was going to happen. God has shown himself to us in so many ways, urging us that he will be our companion and leader wherever our journey takes us. In addition to miracles, we pray daily for joy, strength, courage, and hope. Thank you all for your gift of time and attention today and putting up with me. I hope that you can leave here today and right away take something from my experience living with ALS and make your life more fulfilling and rewarding. May you live your life with courage, compassion, and connection. May you stand up for what you believe and love with your whole heart, even though there are no guarantees. May you embrace your own sense of vulnerability and believe that you are enough just as you are. And may you learn to appreciate and enjoy what you have right now and realize that today is the best day you have today. Thanks.